Good morning. Today is Wednesday, April 1st, 2020. And usually on a Wednesday, when Parliament is sitting, the Prime Minister answers all the questions. It's Prime Minister's Question Period Day, or so it has begun. We aren't allowed to be sitting in Parliament right now, but we do have some questions for the Prime Minister before he comes out to deliver his fuzzy bromides for the day. We have some serious questions. These questions come from people all across the country, but we're going to home in mostly on the ones that are being posed by people here in Renfrew-Nipissing-Pembroke. First of all, they want to know what number of ventilators will we need today? In 15 days? In 30 days? How many hospital beds do we need today? How many will we need in 14 days? 30 days? Who is responsible for getting the respirators and the hospital beds to the places they need to be? How many tests are carried out in Ontario each day for the past 7 days? And which cities are they being carried out in? How many cases have been identified as a result of contact tracking in each city, in each province? How many patients have entered hospitals in Ontario, and which ones, as a result of COVID-19 related sicknesses? How many tests have been conducted by each city per day over the last 7 days? Do we force our nurses, if we foresee any nurse or doctor shortage a month from now, what are the plans in place at this time to address this? There have been cases where people over 60 or 70 years of age are not able to access doctors or medical care as a result of COVID-19. How many people does that apply to? Now, what is the forecast for the next 15 days and the next 30 days in terms of people who will not be able to be seen because we're at capacity? What number of cases are being reported, and would you direct the people who are doing the reporting for the federal government, would you ask them to report of the cases, how many results are still waiting? And we also want to know, for the people who have been told to self-isolate, who have not yet been tested because there aren't enough kits, how many of those in addition will you report when you're giving your numbers each day? Is it true the borders will remain closed until at least June 30th of this year? We've heard that. We just want verification. And that's at least until June 30th is what we're hearing. It's expected that the hospitals in rural areas may reach capacity in places like Eastern Ontario. In rural areas, when the hospitals reach capacity and they're fairly distant from a city, how will that be addressed? What about respirators? Will they be distributed fairly to hospitals who are located outside cities? Or will the respirators, by and large, just be directed towards the hospitals in larger areas. What about the people who live out in the country and do not have access to rural internet? These children, the parents, they want to continue the education, especially in Ontario, where they're not going to go back to work or back to school until at least the beginning of May. And what about those who do have access to internet in rural areas, and now they're at home, children are at home, and they're doing their homework using the internet? Now, some people don't have connectivity, obviously, by internet, so they're using the data on their cell phones. They're going to have bills that are hundreds of dollars in excess of what they would normally have to pay. But their children have to continue their education. So how are they going to pay these hundreds of extra dollars each month when they're not allowed to go to work, and when the situation lifts, they may not have jobs to go back to? So we want to make sure that the children are taken care of in rural areas, and want to ensure that the prices for internet are in line. We also want to make sure that the people along the water areas, the shorelines of Lake Ontario and the St. Lawrence River Basin, are going to be taken care of and have help readily available if the waters rise. A question I had from a doctor is whether or not nurses who are compromised, who have immune systems that are compromised, will they be forced to go to the front lines? And if they don't go to the front lines, will they be receiving some sort of employment insurance or the 2000, the Canadian Emergency Response Benefit? So employers want to make sure that their employees are well taken care of and safe. Now, the military has enough masks and gowns and medical equipment for personnel to last as long as any crisis should last. They have all the equipment stockpiled. Why is it that public safety did not have different stockpiles across the country, so that should a situation arise like this, there would be access to the necessary equipment? We have a question about an announcement you made on Sunday. You mentioned money that would go to seniors through the New Horizons for Seniors program. And you also mentioned the mental health funding for children, and said that it would go through the United Way. Instead of an agency that can actually track to ensure that the money that is being allocated for seniors and for children who are especially suffering psychological issues at this time, so that they are the ones who indeed receive it. Canadians want the money, the tax dollars they will be paying back, to be spent on the people who need it and as it was intended. New Horizons for Seniors, some projects had to be halted. The seniors organizations want to know, will they get an extension because they just can't get the workers to finish the projects that were underway? So they want that deadline extended. And we're seeing things in the newspaper about your wanting or thinking of implementing the Emergency Measures Act. Now, the provinces tell us they have the power to to do what they need to do to get through the crisis. So if the provinces have the power that they need, why is it that you are considering the Emergency Measures Act? Well, it's April 1st, Prime Minister. Where is the money needed for the people who have to pay themselves, like the doctors? The doctors who are going to be working on the front lines now that their offices have been closed. So they are not receiving an income. Will they qualify for the Canadian Emergency Response Benefit? They still have rent to pay. And many businesses across the country, as well as individuals, have to pay the rent today. But we haven't seen the money. When will this money get into their pockets so that the landlords don't put fines on them? And then today, again, April 1st. And today, the carbon tax increases by 50% in Ontario, from $20 a ton to $30 a ton. Now, the streets are very quiet. The planes are grounded. And the factories, many of them are not working. There are no emissions. This is probably the lowest period of time ever in the past, perhaps decade, that we've had such low carbon emissions. With the carbon emissions being so low, why are you increasing the carbon tax today for people who live and work in Ontario? When will residents receive the money so that they can pay the bills that are coming through? Back here in Renfrew County last night, the temperatures dropped below 10 below zero. Now, and probably in other areas it was even colder. And now you're asking the people to pay an extra, hiked tax on their heating bills when the residents have been thrown out of work. When will the money come? I'm looking forward to hearing your answers to this. All the best to you and your family. And all the best to people who are staying in their homes, self-isolating, and going out as little as possible. Thank you. Thank you to the paramedics. Thank you to the companies that are coming forward to help manufacture masks and gowns and respirators. Even local communities are working together on this. And of course, the many people who are taking groceries to seniors. Thank you, everyone who is working together to get through the coming days.